Now let's hear about the different types of diabetes. First of all, there are two types of diabetes, type 1 and type 2. In type 1, insulin is not produced and released at all due to a genetic, autoimmune or viral cause, and it usually starts at an early age. Often the diagnosis peaks around 10 to 14 years of age. It develops quickly over days or weeks and may present as drowsiness, confusion, nausea, vomiting, and a breath that smells of acetone, pay drops, and dehydration. Now, type 1 diabetics must self-inject insulin every day for life to control their blood sugar. In type 2, some insulin is released, but not enough or doesn't work due to a resistance to it. And in this insulin resistance situation, more insulin is produced to compensate for its lack of activity, yet the sugar levels still rise. It usually occurs later in life, progressing slowly, although in developed countries the age of onset is reducing drastically, so that now teenagers are even developing type 2 diabetes as a result of the obesity epidemic. Also, people of African, Caribbean or Asian descent are more prone to diabetes at a younger age. Either lifestyle, losing weight, exercising more, taking tablets or insulin are used to treat it. Now, both types lead to high blood glucose and hence organ damage. Neither can be cured. 90% of diabetics are type 2 diabetics. Diabetes may develop during pregnancy. We call it gestational diabetes, but usually goes once the baby is born, but the mother may be at high risk of diabetes in the future. Now, what is the treatment or medication? Well, type 1 diabetics require insulin to be injected every day, sometimes several times a day, and maybe along with other medications. Type 2, well, some type 2 diabetics can control their condition with diet and exercise, whilst others need to take a combination of tablets. Unfortunately, about a third of diabetics don't take their medications correctly, so risk the long-term serious complications. Now, what about testing for diabetes? Well, this is a subject in itself. Diabetes was once referred to as the missing million, because there are 1 million people walking around out there today unaware that they have type 2 diabetes. They may have some of the symptoms described above, but haven't been to a doctor for a checkup. And unfortunately, all the while, damage has been done to their vital organs. That is why it's important to check for diabetes, especially if you're suffering any of the symptoms, or there's a history in the family, or if you're overweight, or in certain ethnic groups.